St. John's wort can be downright dangerous. I'm going to explain how, guys. As a family doctor, this video was important for me to make because I wanted you to know the potential downsides of St. John's wort. Now, there are potential benefits. We will talk about both, but the downsides is the focus of this video. Now, let's go back, okay? So St. John's wort, what is it? Well, it's a plant. It's a plant with yellow flowers. It has been used in traditional European medicine and likely traditional forms of medicine from other parts of the world as well, going way back, such as many other vitamins and supplements that we are aware of. Now, so you say, well, what has it been used for? Well, historically, St. John's wort has been used for a number of things, whether it's kidney conditions, whether it's lung conditions, whether it's problems with sleep or depression, maybe even wound healing. There have been suggestions of St. John's wort being used topically in some cases. That means on the skin topically. Currently, though, you're probably seeing St. John's wort being promoted a lot for depression, menopausal symptoms, ADHD, obsessive compulsive disorder, even other conditions. The good thing is that there have been studies done saying what St. John's wort can potentially do. There have also been a number of studies done saying how it can be dangerous. I want you to understand that my sources for this video are the NIH, as well as an article from the American Academy of Family Physicians from 2017 on different supplements that people use, okay? So let's start by talking about maybe the things that St. John's wort may actually do, okay? What data we have about how well it deals with certain conditions, okay? We'll start there, then we'll talk about the dangers. So first of all, St. John's wort does appear to be more effective than placebo and as effective as standard antidepressant medications for mild and moderate depression. According to the NIH, we don't know whether this is true for severe depression and for time periods longer than 12 weeks, okay? So please sort of keep note of that. Now, for other conditions, things like IBS, chronic hep C, HIV, social anxiety disorder, and other things, we don't have a lot of evidence that suggests that St. John's wort is helpful. In fact, current evidence suggests that it is not helpful for these. Now, in terms of menopausal symptoms, which I know many people are probably wondering about, St. John's wort might be helpful for menopausal symptoms, wound healing, and other things, but there's really not enough evidence to know for sure. Now, the other thing is that there's not a lot of evidence, or not enough evidence rather, to know whether St. John's wort is beneficial for things like quitting smoking or improving memory, or for other things, anxiety, ADHD, etc. In terms of breastfeeding and pregnancy, we know that it may not be safe to use during pregnancy or while breastfeeding. In fact, it has caused birth defects in laboratory animals, so keep that in mind. Now, I know it took a long time to get here, but this is important. Why I say St. John's wort can be downright dangerous, if not potentially deadly, okay? Let's talk about that. According to the NIH, it has been clearly shown that St. John's wort can interact in dangerous and sometimes life-threatening ways with a variety of medications. We are talking about medication interactions here. And so how does this happen? Well, St. John's wort can interact with enzymes that your body uses to process certain medications, over-the-counter drugs, etc., and may alter that process such that the concurrent use of St. John's wort along with over-the-counter medications, some of them, and prescription medications can actually be dangerous or potentially life-threatening. So what can happen? Well, St. John's wort can actually weaken the effects of many medications that you may need to be taking for very important reasons. Also, taking St. John's wort with certain antidepressants or other drugs may be potentially serious as well. St. John's wort in and of itself can actually have side effects. I mean, many supplements and vitamins can cause side effects of their own. So there's that piece in addition to the fact that there may be potential interactions with other medications and other drugs. And I should say that according to this article from the AAFP from 2017, the statement was made, it's strongly recommended to avoid concurrent use of St. John's wort with over-the-counter and prescription medications. Guys, the take-home point here is that, yes, there are potential benefits of St. John's wort. There's also things we just don't know about how it works and how it doesn't, but there are potential benefits. But by and large and overwhelmingly, St. John's wort can interfere potentially dangerously, if not in a life-threatening way, with other medications or over-the-counter things that you may be taking, to the point where some sources are saying don't take St. John's wort if you are taking other things. This is why I need to do a video on this, because this actually is a really big deal. Now, I'm not your doctor. You have a doctor, but this video is your wake-up call to look at your vitamin and supplement stuff. And if you see St. John's wort, I need you to go to your doctor and say, hey, I saw a video on the Google Schmoogle. This doctor was saying blah, 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 blah. Is this safe for me to take? You need to talk to your doctor doctor about that, okay? And you can look this stuff up yourself. Look up St. John's Wort and NIH, St. John's Wort, AAFP, and other organizations and see what they say too. But talk to your doctor to find out what's right for you, because honestly, this may not be right for you. And for many, if not most people. I'm not your doctor. You have a doctor. Get medical advice from your doctor, but heed this warning and listen closely. Because this could be very, very serious for you and people that you love. Write in the comments what you think, if this is something you've heard, how you feel. I always want to know what you think, guys. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. For those of you on Facebook, please like and follow my page. For those of you who send stars, I respond to you personally. Thank you so much. Also, consider joining my subscription groups on Facebook. I also have them on YouTube, but on Facebook for exclusive content. Guys, on YouTube, if you've not checked me out on YouTube, I've got more videos and other vitamins and supplements if you are interested, as well as Facebook. Please also subscribe to my YouTube channel and click the little bell for updates. Guys, I'm Dr. Jen. Let me know your experiences in the comments. I want to hear from you. Guys, I'm Dr. Jen. I'll see you soon.